Hi, I'm Margarete Jeffers. I'm a social worker and I work for Nayar Hospice. The owner, AK, came to me and said, I had this dream of writing a book about every patient that we have.
My name is AK Nayar. I'm the CEO, president, and founder of Nayar Hospice. And Marguerite started telling me a story about one of the patients, and I said, well, wouldn't it be nice for their grandkids to know a little bit about their grandparents like the way we know it?
He really struck a chord with me. I always wanted to write the story and the history of my family during World War II and after, because my children here in America do not have that knowledge and that mindset. So the project called Legacy of a Lifetime. And so the legacy book is really about preserving memories, preserving stories, talking about the accomplishments and the history of the patients. It's a tether that combines the past with the future. So we're standing on the shoulders of our ancestors and we are being influenced by them, but we also need to know the story. We need to know our roots, where we came from and where we will go. It's kind of a very delicate situation. You come into a family's life where there is a crisis and the family is grieving already because hospice is involved. And yet you have to be very sensitive to the need of the family, but also you want to write about the loved one.
I just want to give you this book. It was a pleasure doing this and writing and learning more about your mom.
Yeah. This is wonderful. Oh gosh, thank you so much. It just made her life a lot easier at the end because she was so anxiety ridden and terrible depression.
Yeah.
And it just helped her so much. Oh my, this would be an honor for anybody that gets it. Anybody. Oh.
And so every story is different and every story is beautiful in their own way. The process is, I have this template that I created. First thing that I try to get a picture of their birthplace, and then I start with early childhood, with school years. I want to know if there are any special memories, any special tradition during that time, the relationship with the parents, the siblings, and then go into college and work experiences, dating, marriage, children. At the end of that visit, sometimes I don't really have a lot of background information. I have to do a lot of research in terms of what happened during that time period. Most of the time I go back and show the book to them and ask if they want to change anything, is everything all right. But I wanted also to know that the story that I wrote captured their individual personality, I captured their lives, and I got it right. I had a patient who grew up in a village that was created by a company, and it was very unique to find those old documents. It's really a challenge sometimes, and you go by a little bit what they tell you, and then you have to do the research because you want what you write being accurate. I had one patient, he had Parkinson and he was not able to speak a lot, but when he talked about his wife, his eyes were lighting up, and she was sitting right there, and he said, she is the love of my life. And those things are so precious, especially when somebody passes a week after that interview. So to have those memories documented, I think it means a lot to the family.
And every new patient that's admitted on hospice gets a legacy book. We get our ostrich leather covers from Canada, so they're specifically made for Nayar Hospice, and they're shipped to us. We have a binding company, a printing company, so we have definitely taken a lot of steps to make sure that it's done the right way, because this is an honor for us to be able to give to the family, and we want to do it the right way because we don't want in any way, shape, or form to be disrespectful by giving something that's not of the highest quality or not showing the correct story. We definitely want it to be honest, and we want it to be as respectful as possible. It's purely coming from a standpoint of recognizing the lives people have lived and the memories they've had over the course of a lifetime.
It's a blessing for the next generation. And I think that is part of the legacy book too, that I'm trying to capture what they have accomplished, what their wishes are for the next generation, but also the blessing that they acquired and the blessing that they are passing forward. And I think that's really, really important to hear for children and for grandchildren, that there is good wishes to them. I wrote a book about a patient who grew up not being allowed to go to school, and she could not read or write. She did everything that she could do to help her children achieve as much as they could. When I read the book to her, because she could not read it herself, her granddaughter was in the room. For the granddaughter to hear her grandma's life story, she sat there and she cried, but she also heard the blessing, what her grandmother wanted her to do, and it meant a lot to her. She said, "That's my grandmother, that's why we love her." And I think that was really, really special.